What if the first place your body starts to age isn't your heart or your brain, but something far more private? That's the question that haunted me when I first noticed changes in my own body at 61. I didn't feel broken. I wasn't sick, but something had shifted. I didn't wake up with the same firmness. The spark I used to take for granted had dimmed, and I thought, is this just how it ends for us? I'm Dr. Mark Hyman, MD. I've spent over 3 decades helping men reclaim their vitality without pills, shame, or surgeries. And what I've learned might surprise you. The earliest signs of aging for men often show up below the belt, long before memory loss or joint pain. As men age, they often assume their decline in intimate performance is just normal. But that slow fade, the dulling sensitivity, the weakening response, it's the body whispering that blood flow is slowing down. Tissues are hardening, and inflammation is creeping in. But here's the good news. This isn't irreversible. That fading spark isn't the end. It's the beginning of your wake-up call. And for many of my patients, that call starts with something as simple and overlooked as castor oil. Not just any oil, but one that reawakens circulation, softens internal rigidity, soothes deep inflammation, and brings back the feelings you thought were lost forever. In today's video, I'll walk you through 8 powerful reasons why castor oil may be the key to restoring not just function, but identity. I'll introduce you to men like Robert, Daniel, and Larry, whose stories will likely echo your own. I'll share what works, what to avoid, and the one mistake that could ruin your progress. This is more than a health tip. This is a return to strength, to connection, and to confidence. And if you've ever wondered, is it too late for me? I'm here to tell you, it's not. Robert came to see me at 6'6", a retired firefighter from Ohio. He sat quietly in my office, then looked up and said, "Doc, it just doesn't respond like it used to." He wasn't talking about desire. He was talking about blood flow. See, as men pass 60, their vascular system begins to slow down quietly. The arteries that once flooded the pelvic region with life start to narrow. The soft, responsive tissue becomes sluggish. Sensation fades. And for many men, that decline hits hard not just physically, but emotionally. This is where I introduce castor oil, not as some miracle cure, but as a natural companion to healing. Its key ingredient, ricinoleic acid, is a compound that gently stimulates microcirculation. It works like a whisper, not a shout encouraging capillaries to relax, coaxing blood to flow where it once surged. With Robert, we started a simple routine. Warm the oil between your palms. Apply to the base and surrounding area 3 times a week. Finish with a warm towel for 15 minutes. A month later, Robert returned. His voice was different, stronger, lighter. "I'm waking up with firmness again," he said, blinking in disbelief. "It's subtle, but it's real." I forgot what that even felt like. That's the first key I want you to understand. When you restore blood flow, you don't just regain function, you revive sensation, confidence, and connection. It's like turning the lights back on in a room you thought was permanently dim. And yet, for some men, blood flow isn't the only issue. Sometimes, the real culprit hides deeper, beneath the surface, where years of tension and micro-injury quietly build something far more stubborn: internal tissue stiffness. And that's what we'll talk about next. Daniel, was 72 when he walked into my clinic, a retired Navy officer from Charleston, South Carolina. He carried himself with pride, but that day, his posture faltered. He sat across from me, furrowed his brow, and said, "Doc, something's off. It's curving, not painful, just not right." I knew immediately what he was describing: internal tissue stiffness, or as we call it medically, penile fibrosis. This condition sneaks in silently. Over years, sometimes decades of microtraumas, inflammation, or simply tension, fibrous collagen begins to build beneath the surface. The shaft loses its flexibility, curvature develops, movement feels limited, and for many men, this change strikes not just the body, but the spirit. Daniel hadn't told his partner. He hadn't even told his doctor until me. And that silence is common. Most men chalk it up to aging and silently grieve what they think is irreversible. But I told him what I tell every man who walks through that door. It's not permanent. It's not too late. We began a focused regimen. Warm castor oil massaged into the affected area 3 to 4 times a week. Not rushed, not aggressive, just slow, steady pressure with a warm towel afterward. Why? Because ricinoleic acid penetrates deeper than surface creams. It reaches into the collagen-rich layers, softening the scar-like tissue that has hardened over time. 6 weeks later, Daniel came back. This time, he stood taller. "It's straighter," he said, "more flexible. I don't feel like I'm fighting my body anymore." And that's the essence of healing, regaining ownership over your own body, not just accepting decline, but reversing it through mindful care. But there's more. Even after restoring flexibility, another silent enemy remains low-grade inflammation. It drains energy, stiffens nerves, and robs you of sensation without making a sound. Let's dig into that next. Michael, 66, wasn't like most of my patients. He didn't come in talking about performance or stiffness. He just looked tired, drained. His eyes lacked their usual spark. When I gently asked what was going on, he said something that stuck with me. "It's not pain, Doc. It's like everything's shrinking, like I'm folding in on myself down there. I feel smaller, less alive." Now, most men wouldn't say that out loud. But what Michael described was low-grade chronic inflammation, a hidden thief that slowly steals vitality, sensation, and confidence. One quiet day at a time. As we age, even small traumas, tight pants, poor posture, lack of movement build up. Blood vessels stiffen. Nerves lose sensitivity. Tissues inflame. And because it's not an obvious burning pain, we dismiss it. But that constant tension, that pulling inward feeling Michael described, that's the body whispering that something's off. This is where castor oil reveals another side of its power. When gently massaged into the lower abdomen and groin, ricinoleic acid acts as a natural anti-inflammatory. It doesn't just sit on the skin, it sinks in, calming immune overactivity and reducing swelling around the pelvic nerves and blood vessels. We developed a simple routine every other night. Michael would warm a few drops between his hands and use circular motions never rushed, always attentive just below his belt line. After a few weeks, something shifted. He sat across from me, smiled, and said, "I don't know how else to say it, but my body feels like it's opening up again." That's the power of calm healing. When you reduce inflammation, blood flows better, nerves breathe easier, and sensation begins to return. But even as the inflammation faded, I reminded Michael, and now I remind you there's another layer to this story, your nerve endings. Because without them, you may still feel nothing. Let's explore that next. Larry was 70, fit, sharp-minded, and happily married for over 40 years. On the surface, he had everything going for him. But during one of our quiet consultations, he lowered his voice and confessed something that hit me harder than most stories. "Doc," he said, "I can still perform, but I can't feel it. It's like my body's just going through the motions." That sentence, "I can't feel," it revealed more than a physical issue. It reflected a deep emotional disconnect that many men experience but rarely talk about. Because what's the point of intimacy if you can't feel the connection? If you don't feel pleasure? What Larry was experiencing was nerve desensitization. As men age, the fine nerve endings in the pelvic region, the ones responsible for pleasure and sensitivity, can go numb. Not suddenly, but subtly. Over time, poor blood flow, constant inflammation, and even certain medications dull the body's natural electrical system. But here's where castor oil becomes more than just a topical treatment. It becomes a tool for reconnection. When warmed and applied with care, castor oil doesn't just reduce inflammation. It nurtures the nerves. It creates a soothing environment that supports nerve regeneration and improved conductivity. This is due to both its anti-inflammatory properties and the way it helps restore tissue oxygenation, indirectly enhancing nerve function. Larry committed to a nightly routine. No distractions, just 10 minutes of stillness, warming the oil between his palms, applying it gently along the base and underside of the shaft, and wrapping the area with a warm towel. Nothing fancy, just presence. After a month, his eyes lit up. "I can feel again," he whispered. "Not all the way, but enough to know it's real. Enough to know I'm still here." And that moment of reconnection, that's where real healing begins. Because when you start feeling again, truly feeling, it's not just your body that wakes up, it's your soul. But even if your nerves are coming back to life, there's a final barrier, one that holds everything together, but too often gets overlooked: your skin. Frank was 73 when he finally brought it up, something he'd kept to himself for years. We were midway through a routine checkup when he paused, glanced down, and said, "The skin down there, it just doesn't feel right anymore. It's dry, thin. Sometimes it even cracks if I move the wrong way. I feel fragile." That word, fragile, isn't one most men are comfortable using. But I knew exactly what he meant. Because while many older men talk to me about firmness, sensitivity, or circulation, few mention what's happening to the skin itself. Yet it's one of the most overlooked parts of aging in men's health. As testosterone drops, collagen production decreases, blood flow slows. The skin, especially in sensitive areas, becomes thinner, drier, and less elastic. Sometimes it itches, sometimes it flakes, and other times it simply tears, leaving not just discomfort, but a growing sense of vulnerability. That's where castor oil steps in as a powerful ally. Unlike most surface-level moisturizers, Castor oil penetrates deep into the dermal layers. Its dense, emollient texture restores moisture and strengthens the skin barrier from the inside out. I told Frank to use just a thin layer 3 nights a week, gently massaged into the skin before bed, followed by a warm compress. No rush, no pressure, just care. After a month, he came back to see me. "I'm not afraid anymore," he said, eyes steady. "The skin feels stronger, and I feel like myself again." You see, this isn't just about softness or comfort. It's about confidence. When the skin feels resilient, so does the man inside it. Because we don't just experience intimacy through nerves and blood vessels, we experience it through touch, through trust, through the feeling that your body is still whole. But now that you know the benefits, there's something even more important to talk about: how to use castor oil the right way. Because a tool is only as good as the way you use it, and most men get this part wrong. I still remember Gerald, a 69-year-old retired pilot, raising an eyebrow the first time I mentioned castor oil. He smirked and said, "You want me to put what where I laughed?" But behind his humor, I saw hesitation. And I get it, trying something new, especially something that feels this personal, can feel awkward, but I told Gerald the same thing. I tell every man, I work with healing doesn't just happen with chemicals, it happens through intention. And when it comes to castor oil, how you apply it matters just as much as the oil itself. First and foremost, use 100% cold-pressed, pure castor oil. No fragrances, no fillers, nothing fancy, just the real thing. I always recommend warming the oil slightly, either by rubbing it between your palms or placing the bottle in a cup of warm water for a few minutes. Warm oil penetrates more deeply and feels more natural to the body. Then, in a quiet space, take your time. Massage the oil slowly into the shaft, the base, and the surrounding pelvic area. Use circular motions. Don't press hard, just listen with your hands. The goal isn't to fix anything in one go. It's to reconnect, to let your body know it's being cared for. If you can, place a warm towel over the area afterward and rest for 15 to 20 minutes. The heat encourages absorption and stimulates blood flow. I suggest doing this 3 to 4 nights a week, no more, no less. This isn't about rushing. It's about consistency. Gerald came back after a month, and I could tell something had changed. He said, "It's not just working, it's changing how I see myself. I look forward to it now. It's like I'm finally showing up for me." That's the real power of this practice. It's not a magic trick. It's a message to your body, to your mind, that you are still worth showing up for. But there's one thing I need to warn you about. Because even with the best intentions, most men make this one critical mistake, and it can undo all the progress before it even begins. The most common mistake I see men give up too soon. Thomas was 72, a retired engineer, sharp as ever. He'd spent his life solving problems, and he expected this to be no different. When I suggested using castor oil, he gave it a try. But after 5 days, he told me, "Doc, I don't feel anything. This stuff doesn't work." I looked at him and said, "Thomas, how long did it take for those arteries to stiffen, for that skin to thin, for sensation to fade?" He paused, then nodded. That's the hard truth. Most men want instant results. They've been conditioned by a culture that promises quick fixes, pills that work overnight, ads that guarantee miracles. But healing, real healing, takes something far more powerful: consistency. Your body isn't a broken machine. It's a living, breathing system. And like any relationship, it takes time to rebuild trust. I asked Thomas to give it 4 full weeks. Just 3 to 4 nights a week. No pressure, no expectations. Just care. When he came back, the change in him was undeniable. He sat straighter. His voice was lighter. "Doc," he said, "I'm not chasing results anymore. I'm learning to work with my body. And it's starting to work with me." That moment, it's everything. Because once you shift from impatience to presence, from forcing to listening, you unlock the true power of this ritual. Blood flow improves. Tissue softens. Sensation returns. Confidence rebuilds not just in your body, but in your identity. But perhaps the most beautiful part is what comes next. Because beyond the skin, the nerves, the function, there's something deeper that begins to awaken. Something most men don't even realize they've lost until they start to feel it again. And that's what I want to talk about in our final moments together. How this journey isn't just about healing your body, it's about reclaiming who you are. I've spent over 3 decades walking beside men just like you through some of their most private struggles. And what I've learned is this: the deepest transformation doesn't come from a bottle. It comes from a shift inside. See, castor oil is just the tool. What matters more is the ritual, that quiet, consistent choice to care for yourself, to tune back in, to remember that your body, despite the stiffness, the numbness, the changes, is still alive, still capable, still listening. Men over 60 often tell me they feel invisible, like their best days are behind them, like their body has betrayed them. But I'm here to tell you, from one human being to another, you are not broken. You are simply waiting to be heard. And this practice, these 15 minutes, a few nights a week, it's a way of listening. It's not just about firmer erections or softer skin or better sensation, though. Yes, those things matter. It's about confidence, about the quiet strength of knowing your body is still yours, that it can still respond, that you're not finished yet. When men start showing up for themselves without shame, without shortcuts, something magical happens. They begin to reconnect with their partners. Their spark comes back. They stand taller, speak clearer, sleep better. They laugh again. And they start to live again, not just exist. So here's my invitation to you: begin. Not tomorrow, not when it's convenient. Tonight. Go get that bottle of castor oil. Warm it in your hands. Find a quiet space. Turn off the noise. And take those first small steps back to yourself. Because healing isn't about going back to who you were. It's about becoming who you're still meant to be. And I promise you, there is more life, more joy, more connection ahead than you ever imagined. Let's begin again. Together.